Adjust your step. Good afternoon, everybody. Thank you for coming. Today's order of speakers will be the Medical Officer of Health for the City of Toronto, Dr. Eileen, the General Manager of Office of Emergency Management, Fire Chief Matthew Pegg, as well as Bédard, who's our General Manager of Social Support, Housing and Administration. Following remarks, we'll take questions. City Manager Chris Murray is also here. I'm sure you have a number of questions for Mr. Murray, and we will take those following the remarks by those speaking this afternoon. So I will ask Dr. Davila if she could come up, and followed by Chief Pegg, then Marianne. Thank you.
Okay, thank you. Good afternoon, everybody. Thank you, Brad. So by way of an update, in terms of our current situation, we have 108 confirmed cases of COVID-19 in Toronto as of today, 4 of whom have recovered. And as you've heard me say in recent days, we've seen an accelerated pace in terms of new case onset in these recent days. And as well, we have seen some early signs of local transmission. That's why you've seen in the last few days all 3 levels of government implement unprecedented public health measures to require social distancing. I recognize that these public health measures are disruptive. They're difficult, and they have forced each and every one of us to make significant adjustments to our daily lives. But as difficult as they are, I can tell you that when we look at the experiences of other jurisdictions, we know that these measures, these social distancing measures, they work. But I want to be clear with you. While we know that these measures work in terms of reducing the spread of COVID-19, they take time before we see their full effects. Social distancing works, but as is the case with any treatment or any medicine, it needs to be applied at the right dose for a sufficient amount of time. With this in mind, we can and we do expect to see continued increases in our case counts in the coming days and weeks ahead of us. In particular, based on the data that we have right now, we should expect to see continued increases in cases amongst those who traveled outside of Canada, and especially those who traveled to the United States. Because of this, anyone who has traveled anywhere outside of Canada, and especially the United States, please stay home and avoid contact with others for a 14-day period after you return from your travel. I'm also at this time asking everyone, every person and every business, please make every effort, take every opportunity to implement social distancing. My message to you today is simply this: stay at home, stay safe, and take care of each other. With that, I'll now turn the mic over to Chief Pegg.
Thank you, Dr. Davila. Good afternoon. The COVID-19 situation continues to evolve very quickly. both within the City of Toronto and beyond. As you know, the Premier declared a provincial emergency earlier this morning. In declaring the provincial emergency, a number of orders have been issued, which is normal under the emergency declaration process. The City's Emergency Operations Centre continues to operate effectively and respond to the evolving situation. In light of the emergency declaration, we have transitioned to Level 3 operations, with some additional support staff being assigned to the EOC. In response to the continuously evolving COVID-19 situation, we are making a number of adjustments to service levels provided by the Toronto Public Service. We are implementing these changes in a considered and measured manner that is consistent with the advice being provided by Toronto Public Health and that balances the needs of the communities we serve with those of our dedicated city staff. First and foremost, let me confirm for everyone the city services that are not being affected and are not being adjusted or reduced. All emergency services, including police service, fire service, and paramedic service emergency response, will continue to operate as normal. Toronto Water continues to ensure our drinking water is reliable, safe, and remains at the high standard we have all come to expect. Shelters and respite sites remain open. City-operated long-term care homes will continue to operate. Garbage collection will continue as scheduled. Road operations, including snow removal services if required, will continue as normal. Toronto Hydro is operating normally. The TTC is operating normally. 311 continues to operate normally. And of course, our Emergency Operations Centre and COVID-19 task force teams working on the city's COVID-19 planning and response will continue without interruption. There are, however, a number of city services that are being suspended until further notice. Examples of services that are being suspended include many of the city's administrative functions, counter-based services that are provided in City Hall and other facilities, and marriage services in city facilities. We appreciate that the list of service changes is both long and continues to evolve. All of this information, including the details on each service level change, will be updated online today and overnight. This information is available to the public at toronto.ca/COVID-19. To that end, effective tomorrow, all City of Toronto municipal buildings will be closed to the public, including City Hall, Metro Hall, and each of the civic centres. City staff who are not in a role that directly enables the continued delivery of essential services will be directed to remain at home. As advised earlier by the Mayor, these changes are effective immediately. The implementation of these service level changes on a division-by-division basis will be completed as soon as possible, understanding that each service area has different plans and processes that need to be put in place. Tools and resources are being enhanced in order for city staff to remain connected, informed, and productive as this situation continues to develop. Employees who are not returning to work to provide essential or other critical services will be recalled to work on a priority need basis as the COVID-19 pandemic situation evolves. Each division and agency head is in the process of communicating with their respective staff teams, such that clear information is being communicated to all staff. The decision to reduce city services and reduce public access to city facilities is a difficult one. However, it is important that we too need to implement effective social distancing as recommended by Toronto Public Health as we all work together to slow the spread of COVID-19. It is important to note that this is a rapidly evolving situation, and we will continue to keep our workforce and the public updated as the situation evolves. We will continue to make decisions in consideration of the advice being provided by Dr. Davila and Toronto Public Health. Our public health call centres continue to experience an incredibly high volume of calls. Many of the questions being asked can quickly be addressed by accessing toronto.ca/COVID-19. I encourage everyone to make this your first point of access. Please do not call 911 when seeking information about COVID-19 or about city services. 911 is for use in emergency situations requiring response by Toronto Police, Toronto Paramedics, or Toronto Fire Services only. We have recently become aware that there are a number of scams being reported in relation to COVID-19. I want to be very clear. Neither the City of Toronto nor Toronto Public Health are going door to door, nor are any type of COVID-19 testing kits being offered for sale. The City encourages residents with questions they have about city services to visit toronto.ca/COVID-19. The website is being updated continually with key information, including public health information and resources. In closing, I want to reassure everyone that essential public services provided by the City of Toronto are being maintained. We are continuing to manage the COVID-19 situation and will continue to update you as the situation changes and as any further adjustments to city services are implemented. I will now introduce my colleague, Marianne Bédard, General Manager of the City's Shelter Support and Housing Administration, to update you. Marianne.
Thank you, Chief Pegg. And good afternoon. The City is committed to continuing to look after people who are experiencing homelessness. We are working closely with all levels of government to ensure a fulsome response, and some of our actions are the first of their kind in Canada. We are taking these steps because we know that many people experiencing homelessness have underlying chronic medical conditions that increase their risk from COVID-19. I want to confirm that all city-run 24-hour services for people experiencing homelessness will remain open. Our street outreach services will continue. Our referral and central intake programs will continue to help people who are seeking shelter. The City is maintaining regular contact with our community partners to understand how their services are being impacted by this evolving situation. We are encouraging them to remain open and to modify their services as needed. Please refer to the City's website or Homeless Help to receive updated information about services and any service impacts, including meal programs, shelters, and drop-ins. The City is committed to continue to care for our homeless, refugee, and newcomer populations who need shelter in safe, caring, and responsible ways. We have a very committed and caring City staff to do this, and we have very committed agency partners who help us run the shelter system. I would like to thank our partners in the Inner City Family Health Associates, the Inner City Health Associates, Toronto Public Health, our many community partner agencies, and the City divisions who are supporting us. Without them, this work would not continue. As mentioned, we know that many people experiencing homelessness have underlying chronic medical conditions that increase their risk from COVID-19. Many homeless services have minimal ability to isolate clients, and as a result, the risk of spread of COVID-19 within the shelter system is significant. I would like to stress that as of noon today, we have no confirmed cases of COVID-19 within the shelter system. Based on the evidence and medical advice we have received, we know we need to act quickly to delay the introduction and spread of COVID-19. This will give us critical time that is needed for planning so that we are prepared for what we know will happen in the coming days and weeks. We are prepared. We have a 3-tier response that is already being implemented. First, we are creating the ability for social distancing within our existing programs through the creation of new programs and rapid rehousing. The first site opened yesterday, and there are 4 additional locations opening tomorrow within closed city facilities. As these services open, the information will be available on the city's website, and we will notify our community partners to ensure people know where to go. We are working with Toronto Community Housing to identify vacancies that are immediately available to provide permanent housing solutions for people. Let me be clear. This is not about creating additional capacity in our shelter systems. This will allow us to move people out of the existing programs, particularly our 24-hour respite and drop-in programs, to create the opportunity for social distancing. Secondly, we are implementing standard screening processes using Toronto Public Health guidelines at all entry points, phone or in person, for those seeking shelter. Anyone wanting to access the shelter system who should be assessed for COVID-19 is being referred to one of the province's assessment centres. People who are experiencing homelessness who are being tested for COVID-19 will not be admitted into the regular shelter system. We have opened a special program for people under investigation of COVID-19 while they wait for their test results. This process was initiated earlier this week, and we will continue to move people to this location as needed. This is the first medically supported isolation service for people who are homeless in Canada, and it allows them a safe place to wait for their results. This would not have been possible were it not for the support of our partners at the Inner City Health Associates. Our third-tier response is underway. We are working with our provincial partners to identify an appropriate service for people who have tested positive for COVID-19. Let me be clear again. We do not have anyone currently in the shelter system who has tested positive. But we want to make sure that we have an appropriate program available when this occurs that has the appropriate medical supports for people who are sick and for the people who are caring for them. As you know, Toronto receives an average of 100 refugee claimants a week who need shelter. Based on the recent recommendation from our Medical Officer of Health, we know that it is important for anyone coming into Canada in the last 14 days to self-isolate. We have asked the federal government to screen and support self-isolation for anyone entering the country in the past 14 days at the border who do not have their own means to be able to self-isolate. The actions that the federal government took yesterday to close the border will likely reduce the number of refugees who are in this situation and who need support from our shelter system. People who have entered the country in the past 14 days who present themselves in the Toronto shelter system are being accommodated at a central location so that they are able to self-isolate as recommended. We are also identifying people already in the shelter system who require self-isolation, and we are making this program available to them. We are working closely with Toronto Public Health, and we are providing all the staff at our city-run shelters, as well as our partner organization, with advice on enhanced infection prevention, control, and cleaning measures. We have provided financial resources to our partner agencies to help cover the additional cost of cleaning supplies for people who are working in the system. These measures that we are undertaking and announcing today are for today. As you know, this is an evolving situation, and we are committed to remaining nimble and responsive to the needs of this vulnerable community, and we will scale up and adjust our services as needed. Thank you.
Questions, folks? There's a microphone there. If you could please use that. 2 questions, and then if you need another, you could just make sure everybody gets an opportunity. Mark?
Chief, Explain for us, please, now that we're at level 3, how does that work in terms of how your emergency operations center is going to function, and do we see more boots on the ground specifically for paramedics or firefighters? And Dr. Davila, whether you two want to answer this together or not, but what is your leadership role now in level 3? Because I understand that the emergency center takes over a little bit more, if I have that right.
So the transition from level 2 to level 3 brings with it some additional resourcing into the Emergency Operations Center, and that actually happened over the course of yesterday and is now in place. So there isn't a material change in the way that this incident or this situation is being managed. We have been proactive and in essence productive and ahead of the curve with respect to emergency management from the inception of this situation. So this is really more of a formal transition to level 3 that's triggered by the provincial emergency declaration. We have the resources and the people we need in the Emergency Operations Center to make effective decisions. We are directly connected at all times with the city's senior leadership team, with Mayor Tory and elected officials, and all of those processes are robust and nimble. So level 3 is really just indicative of the response or responding to the provincial emergency declaration, ensuring that we can remain in place and remain ahead of and abreast of the changes that are happening. You know, as we've talked about, this situation is evolving not even day to day, it's evolving hour to hour. And of course, as any information change or any circumstances change, the Emergency Operations Center and our task force need to be able to pivot. They're doing a magnificent job of that, well-resourced to do it, and as evidenced by the exceptional response and decision-making we're seeing come out of the EOC.
And just to speak to the public health component, well, clearly as the local public health department, we are the lead on the public health aspects of COVID-19 and the COVID-19 response. But this response has to occur in collaboration with our city partners and with the entire EOC operation.
Chief Pegg, according to some sources that we've been speaking with, there are at least 30 members of one platoon within the fire department that have had to be isolated. I'm just wondering if you can confirm some numbers for us and tell me at what point would you see your department in a strategic disadvantage and have to reach out to the federal government or some other area to actually fill those gaps?
So I can't actually confirm specific numbers. I can tell you, though, yes, we have Toronto Fire Services has a number of personnel who are in self-isolation, as does the rest of the city, as do many of us within our communities. You can appreciate that Toronto Fire Services is a large organization. There's more than 3,200 personnel assigned to that. So on the basis of sheer math, I would say we're certainly not surprised that we've had people who have moved into self-isolation as a result of directly returning from travel. I will say, and it's important to note, I appreciate the question, the emergency response services and the core and essential services being provided by fire services today are as normal. There is no reduction in frontline emergency service that's being provided, nor are we concerned at this point. There's nothing indicating to us that will change whatsoever. The team back at Toronto Fire and, of course, connected live time through the EOC is constantly monitoring those things. If you asked a hypothetical, I'll give you a hypothetical answer. If hypothetically something were to arise that caused us concern, that would be proactively identified, would be managed and mitigated within the EOC, and we would respond accordingly. But your last question with respect to reaching out to the feds, I've never seen that happen. Highly unlikely here. Fire Services is a very well-resourced organization. We are equipped and prepared to respond to the incidents that happen across the city, and I'm absolutely confident we'll continue to meet the needs of the city as we move through COVID-19.
If I could just follow up, are you concerned about burnout from members of your certain platoons having to pick up the slack?
At this point in time, it's normal operations. So we have not implemented any different. There's no different shift rotation. There's no different deployment model in effect. So we are preparing. I will say I had a conversation with Acting Chief Jim Kay, who of course is carrying the lion's share of that load locally right now. Those plans are in place. There's a lot of great conversation going. I will say that that both the Toronto Fire Services and the Toronto Professional Firefighters Association are in direct contact, working in collaboration. Like I said, I have every confidence that we will be able to continue to meet both the demands of the city and to do so in a manner that that protects the health and safety and the efficiency of our crews.
And to Dr. Davila, yesterday you've repeated this notion that you think that there is community spread within Toronto. Have you been able to source some of those sort of question marks yet, and have you seen that number rise? I think that yesterday you said it was about 3 cases of community transmission. Has that gone up, and have you been able to find any answers to those dying questions?
So thankfully, the number has not gone up. I've heard of no further evidence of community transmission. I do think it's important to note that the vast majority of our cases are associated with travel outside of Canada, and as I mentioned earlier this afternoon, travel to the United States figures prominently there as well. So I can't emphasize enough how important it is for those who've traveled outside of Canada to stay home and to reduce contact, to avoid contact with others for that 14-day period after returning home. We're continuing to investigate. I have no further news to report in respect of those cases that we believe to be evidence of community transmission, but we will continue to investigate those, and I will provide you with updates as I have them.
Dr. Davila, can you comment on the homeless population and the plan that was outlined? Because we know from other jurisdictions that certainly that is a population extremely vulnerable to mass infection.
So I think you've heard some excellent comments from my colleague from Shelter Support and Housing Administration. I know that there has been a considerable amount of work in respect of addressing the needs of our homeless population as we seek to respond to COVID-19 and mitigate the impact of this disease on our community, and in particular on those who are experiencing homelessness in our community. I've been incredibly impressed with the collaboration and the work that has happened between our colleagues here at the city, ourselves at Toronto Public Health, healthcare partners, those who are providing services and healthcare services in particular to those experiencing homelessness. And I can also speak to the fact that there is a table that is meeting regularly, every day in fact, between city staff and those in the community sector who are providing essential services to this population. It is top of mind. We are making sure that every protection, every measure that we can deploy is available and being used to protect their health.
And just to follow up, I'm not sure if anybody here can handle it, but I'll ask, is there are people who are being made homeless because they're being evicted because they can't pay rent. We have heard some talk about some move. I don't know if Social Service and Housing can talk about that. Is there anything in place yet to help people who are actually being evicted this week?
Thank you. Well, we do know that the province has taken some steps to limit eviction notices and the movement of the sheriff. Shelter Support and Housing also has a robust eviction prevention program. We are considering those services critical, and we are maintaining those services during the COVID-19 outbreak. So we'll continue to work with our community partners and our city partners to support anyone who might be experiencing an eviction notice, to make sure that we're maintaining their housing and not increasing the number of people seeking shelter.
Dr. Davila, yesterday you mentioned there were 4 people in hospital. Just wondering if that number has changed with the new cases you mentioned today. And for you and Chief Pegg, you both are traveling around the city in your daily duties here. Your observations as to, for at least 48 hours, you've been telling people to stay home. What are you seeing when you look at the streets?
So with respect to the first question, when I touched base with the team today, it continues to be 4 people in hospital at this stage, and we're thankful for that. And certainly, I know that you'll join me in wishing a speedy recovery and all best health to those 4 individuals who are recovering, and of course to their families. With respect to what I'm seeing, I have been impressed. I've been impressed that people in our city are heeding our advice. But we would urge them to continue on. As I mentioned earlier, the social distancing measures work, but they must be applied consistently, and we need people, wherever possible, to stay home. This is the best way we can assure the safety of ourselves, our families, and our entire community. So while I have been impressed with what I've seen thus far, I would continue to urge people to stay home as the best way to stay safe and to press on. We recognize that it's disruptive and it's difficult, but we can't emphasize enough how very important it is.
Dr. DeVille, I'm going to call you back, actually, sorry. We've heard some anxiety for people as they're going out for the critical things like groceries, about crowding in stores. Is that a paranoia, or is that a well-placed fear as they're talking about trying to exercise social distancing? Is there anything the city can do to force stores to, maybe limit how many people come into the store at a time, set up lines so there are spaces between customers?
Well, I think there are a number of reasonable measures that can be put into place. And as you know, the public health measures that have been implemented thus far, the ones that have been implemented by us at the local level, echoed by those at the provincial and the federal level, they're relatively new, and they're just coming into action and implementation right now. So with that in mind, we're very carefully observing to see what impact we're having, whether we're getting the desired effect in terms of these public health measures. We do want to see social distancing. That's the major point here. And why do we want to do that? Because we know it works. We've seen from other jurisdictions that when we're able to effectively increase the distances between people, when we're able to effectively reduce the interactions, every single interaction, every last one that we prevent from happening actually makes a difference in terms of reducing the spread of COVID-19. And that's what we're aiming for here. So when we look at what's happening in stores, and we recognize that people need to go out and purchase food. They may need to get to a pharmacy to buy medication or other essential products. So we recognize that that's going to have to happen. But again, we're encouraging people to stay home where possible, to limit outings to those occasions where you need to go out and purchase those essentials of life, whether we're talking about food or medication or that kind of thing. And if we effectively are able to do that, then I think we'll avoid, further problems with respect to crowding.
Okay, and a question for Chief Pegg, actually. We've heard that some paramedics are feeling really overloaded dealing with calls as they're coming in, and in some cases feel that they can't say no to people who feel that they may have COVID-19 or just afraid that they may if they have something that is within the scope of the symptoms. So is that something, can you talk about how that is being dealt with on the front lines? Is there anything that can be done to change that so that people who aren't sick aren't going to the hospital?
So I can certainly say from lived experience that each and every one of the emergency responders in Toronto, and that absolutely includes and often begins with Toronto paramedics, are doing incredible work. They do it every day, and under these challenges, all of our frontline workers, and certainly including paramedics, police, and firefighters, are responding to additional load. They're having to navigate that, and everything, I can tell you everything that I see, everything that I hear, and I am in direct daily contact with both Chief McEachern in paramedic services and Chief Saunders in police services. Those services, like I said, for fire, police, and paramedic service frontline is continuing without interruption. the service demands are being met, the needs of our population, the needs of our residents are being met, and really that's a tribute to the hard work of the women and men that are performing that role. So I'm not, I haven't heard anything to the contrary. Literally not an hour ago, the latest update I had from Chief McEachran and Chief Saunders, both of their respective services operating well, meeting the needs of our population and our citizens, and certainly on behalf of both chiefs, I can say that all three emergency services absolutely are positioned well and are resourced and are prepared to meet the needs of our city as we get through this together.
Dr. Davila, you mentioned earlier that the City of Toronto should expect more cases of COVID-19. Are you specifically expecting more cases of community spread or travel spread, if that's the right phrase?
I think we should expect to see both kinds of cases. I think we should expect to see cases associated with travel outside of Canada. That has been, thus far, what has made up the vast majority of our cases. But as we've said from the beginning, we had always anticipated that at some point we would encounter community transmission, local spread. This is what we've seen in other jurisdictions that are further ahead in terms of the disease transmission, and so we're not surprised to see it here in our city.
Dr. Davila, just with all the talk about social distancing, the province's recommendation against gatherings of more than 50 people, can I ask what you think of what you're looking at in front of you right now in this room? Is this what we should be doing?
Well, I think what we should be doing is absolutely practicing social distancing. You can see that we've tried to space people out and respect that distance, and we'll also try to reduce the amount of time. I think these are important elements in reducing disease transmission. I think it's important that we look, though, at how this disease is transmitted, and the best of evidence in respect of disease transmission, in respect of COVID-19 transmission in particular, is that it is transmitted by the respiratory droplets, the secretions, the stuff that actually comes out of people's nose and mouth, and you have to have direct contact with that. That's the most effective route of transmission. Those droplets, those respiratory droplets of somebody who is sick, need to get into your eyes, your nose, or your mouth. So if we are all practicing good respiratory hygiene here, we should be minimizing that opportunity from happening. I can't emphasize enough, if you're sick, if you have any symptoms of respiratory illness, you should be staying at home. I would encourage each and every one of you, whether you're viewing this here or from a remote location, wash your hands. Wash your hands frequently. Wash them for a sufficient amount of time. You need at least 20 seconds. And I'm sure you've heard about people suggesting that you sing, the birthday song or something like that so that you're getting sufficient hand washing time. And again, I can't emphasize enough, stay home if you're sick. And we're asking people, if you've traveled, you should be self-isolating. Traveled outside of Canada, including the United States. We're asking you to stay home and avoid contact with others for a 14-day period after your return from travel. These are the things, along with social distancing in its many different forms, these are the things that will help us reduce the spread of COVID-19.
Sorry, me again. I'm just wondering, we've heard from a number of locations that, I know Chief Pegg spoke about not calling 911. You've repeatedly said this as well, go on the website. Hearing about a number of locations turning people away when it comes to testing. Can you just deliver that message one more time about when people actually need to go and when they should be avoiding these locations so they're not tying it up for those who need it?
So I think you've heard my colleague, Chief Pegg, speak about the website, toronto.ca/COVID-19. There is a wealth of resources available there. So if it's information that you're seeking, we're asking that people make that their first stop. Check the website. We have lots of information there. questions and answers, many resources for the many different issues that are relevant to the residents of Toronto as they think about COVID-19 and its impact on themselves and their families. So first and foremost, I would ask people to check the website. There are also a variety of tools and resources if you're concerned about your own personal health and the chance, you're concerned that you may have a COVID-19 infection. There is a self-assessment tool that our provincial colleagues have published, and it's online through provincial website. I would encourage people to take a look at that, use that self-assessment tool to help them guide their way through the process, to make a determination. It is a very useful tool for helping one make decisions around what kind of care they need and how best to seek that care.
Thank you, everybody. Just before you go, and I want to thank our interpreters who are here today and will continue to be here. These briefings will continue, despite there will be no public access to City Hall. Media access will be maintained, and we will continue to hold these briefings here at 3:45. Unless otherwise notified, we'll issue an advisory each morning. Thank you all very much for coming, and we will see you tomorrow. We don't have to hold press conference. No, if that's what Nick doesn't want. No, I think he just doesn't.